Hello, I'm Susanna Hopsalerin with Hospitals and Health Networks magazine. Today I'm joined by Dr. Molly Coye, Executive in Residence at AVIA. She's well known for her work in healthcare innovation, public healthcare policy, as well as a former board member of the American Hospital Association. It's a pleasure to have you with us, Molly.
Thank you. It's wonderful to be back with AHA.
Molly, when we're looking at digital innovations, how is that going to change rural healthcare, and what are some of the challenges that it can solve?
Well, the biggest challenge that I think both the rural health systems feel and that digital technologies are very well designed for is access. That basically we don't have enough providers, they're not distributed correctly, and the distances are so huge that we have a big gap right now, and that gap is becoming worse because we're learning more about how to help people have better health. And for people with chronic diseases, any kind of chronic condition, that means very frequent contact to support them and coach them in improvement. And there's no way to do it in a rural setting without these digital tools.
And what are some of the most successful digital tools? What's working right now?
Well, I would start with the remote monitoring for patients when you discharge them from the hospital. The ability to follow them and know several times a day, if they're really in trouble, hourly, how they're doing, to monitor them and then remotely coach them and help them because they don't have to come in for everything. So that's really making a big difference today.
What about behavioral health?
Well, behavioral health is another area, and actually we've been doing some good learning from the Veterans Administration with their telepsychiatry program and from the United Kingdom, from England, in terms of their remote cognitive behavioral therapy. That's a fancy term for basically an online learning system so that people who have anxiety or depression can be helped, again, without having to come in and see a provider.
If a hospital CEO and the board of trustees are trying to figure out a digital strategy, what advice do you have for them?
Well, first of all, start with the problem list that is most important to you in your hospital, for the board and for the leadership of the hospital and the providers. What are the things that are really making their life miserable now? So access, obviously, is a problem. The patient experience, the need to refer more patients out for care in a big city than really is necessary. They can care for a higher level of acuity if they have support. And so take those problems and look for the solutions. Don't start with a neat gizmo, a shiny thing, and try and figure out how you could use it.